Welcome to Lesson 14. We're going to be talking about disposal and destruction of controlled substances. We'll be covering pages 76 through 80 in your book, still in Chapter 2. So if you open your book up to page 76, we'll be starting with the letter E at the top of the page. So we're going to start with disposal and destruction of your own controlled substance inventory. So these are drugs that have not yet been dispensed. They're still part of the pharmacy's controlled substance inventory. And number one is on-site destruction. So you're going to actually destroy the controlled substances in your own pharmacy. So this doesn't really happen very often in practice because there are complexities that make it difficult. But you do need to know how to do this and how to use a DEA Form 41. The reason you don't see it in practice sometimes is it's difficult to meet the DEA requirements that the drugs are non-retrievable, to find the right method of destruction. And also there's a lot of other laws that come into play, environmental protection laws that prevent you from flushing it down the toilet or down the sink or things like that. You might use this process more maybe in a hospital setting, but I don't imagine most community pharmacies do actual destruction of controlled substances on site on the premises. But again, you still need to know how to do this. So this is done with the DEA Form 41, and the form requires you to list, obviously, the name of the drug you're going to destroy, the NDC number, the drug strength, form, package size, quantity, the methods that the drugs were destroyed, and it also requires 2 signatures of employees who witnessed the destruction. Now the DEA Form 41 also has a bottom section that's used to, if you're going to destroy drugs that you collected from patients that are not part of your inventory, and you're going to destroy those on the premises. So it has 2 purposes, one for destruction of stock drugs and also for destruction of drugs you collected from patients if you're an authorized collector, and we'll talk about that in a few moments. But 2 different sections of the form are used for that. Now I mentioned that DEA requires that you have 2 employees who witnessed the destruction have to be included on the DEA Form 41. On the bottom of page 76 and over to page 77, I've got the Florida law on destruction for you. And the Florida rule, it's actually a rule, is more specific, and it requires pharmacies using DEA Form 41 for destruction. It requires specific people to be the witnesses. So here's a good example where you got a very specific Florida law that's stricter and you must follow, so it'd be a good source for a question. So in Florida, the witnesses have to be the prescription department manager, that's for community pharmacies, we'll learn about later, or the consultant pharmacist of record if it's an institutional pharmacy. That has to be one witness, and the other witness would have to be a DEA agent or a Department of Health inspector. So that's one option. The other option would be a prescription department manager, the consultant pharmacist of record, and then maybe the medical director if it's an institution like a nursing home or something like that. And actually, you wouldn't do this in a nursing home because drugs in a nursing home, which are class 1 pharmacies, have already been dispensed, so they wouldn't have any stock drugs to be destroyed. It would have to be the medical director, maybe in a hospital or something like that. Now I have a study tip there for you because I thought this would be a really good source of a question because it's very specific to Florida, and I always found this one interesting. The Florida rule on destruction using DEA Form 41 also stated that a copy of the DEA Form 41 after the destruction was done had to be sent to the closest DEA office within 1 business day after destruction. And I found that curious because the DEA Form 41 itself says you do not have to send it to the DEA office unless requested to by the DEA. And I think somebody realized that, maybe they read my book, I don't know. And the Board of Pharmacy, as I was getting ready to go to publication, had just proposed a rule to eliminate that requirement. But that will probably be finalized sometime in 2023, but I can't tell you when. So if you happen to get a question on it, you have to do it within 1 business day of destruction. That's currently the law, but that's probably going to go away sometime in 2023. So that's how you destroy drugs on the premises using a DEA Form 41, which again is not used that often. The preferred way to destroy controlled substances you have, and when we're talking about destroying them, why would you want to destroy them? Probably because they were expired or something, and there's something wrong with them, you can't return them for credit, right? So, but if you can't return them for credit and you need to get rid of some controlled substances in your pharmacy, the preferred method to get rid of them is to actually transfer these controlled substances to a reverse distributor, because reverse distributors actually, they're in the business of taking drugs back, not just controlled substances, but including controlled substances, but any expired drugs or drugs that it can no longer be used. A reverse distributor will take them back and they will destroy them on their premises. So they probably use DEA Form 41 a lot. But when you send controlled substances to a reverse distributor, you don't use Form 41 because you're not the one destroying the drugs. What are you doing in that case? Well, you're simply transferring the controlled substances from your pharmacy to another DEA registrant, the reverse distributor. So what's required to do that? As you learned in the previous lesson, any transfer or distribution of a controlled substance has to be documented with either a 222 form, if it's a Schedule II drug, or with an invoice, if it's a Schedule 3 through 5 drug. So if you're going to send drugs to a reverse distributor and it's a Schedule II controlled substance, what would be required? A DEA Form 222. And remember, who fills out the DEA Form 222? It's the person who's receiving the drugs. Well, who's receiving the drugs in this case? It's the reverse distributor. So they have to initiate and fill out the 222 form and send it to you. How do they know what they want? Well, you're going to have to get on the phone and call them and say, okay, I've got, 4 boxes of expired 10 milligram morphine injections. I've got 3 bottles of expired 100 count oxycodones. Whatever you want to get rid of, you call and tell them, and then they're going to send the 222 form to you, make a copy for themselves, and then you would fill the order and send it back to them. And remember, you would have to report that distribution to DEA through that email address because you're not an ARCOS, you're not involved in the ARCOS system to report transfers of controlled substances. If it's a Schedule 3 through 5, all it's required is an invoice rather than a 222. And as the person sending the controlled substances, you would have to create the invoice to send to the reverse distributor. The tricky thing there is you don't use a DEA Form 41 because you're not the one destroying the drugs. Now I mentioned that you would not use DEA Form 41 in a nursing home. And the reason for that is drugs that are sent to a nursing home have technically been dispensed. Florida is kind of odd, and we'll get to this when we get to the Florida section, but Florida, even though those drugs have already been dispensed, since they're being stored at the nursing home, Florida actually requires a pharmacy permit for nursing homes. It's called a Class 1 institutional pharmacy permit, and it's mainly for nursing homes. So even though those drugs have been dispensed, there's still a pharmacy permit for that facility. But since those drugs have been dispensed, you wouldn't use DEA Form 41 to destroy them because they're not part of the pharmacy who dispensed them. It's not part of their inventory anymore. They actually technically belong to those patients in the nursing home. But if, let's say, the patient expired or moved away, or their drug got discontinued and the drugs can't be sent back for some reason, and you have controlled substances at a nursing home, and you need to destroy those, Florida has a method to do that. So this is a Florida rule on the bottom of page 77 that shows you the documentation that's got to be used when a consultant pharmacist for one of these nursing homes wants to destroy controlled substances at the nursing home. It requires witnesses, as you can see on the top of page 78. You have to have at least 2 of the following witnesses. And they list for you there the consultant pharmacist for the nursing home, the director of nursing, the facility administrator, a physician or mid-level nurse, or another pharmacist employed by the facility, or a law enforcement officer. So again, the study tip there on page 78, you wouldn't use DEA Form 41, again, because these drugs have already been dispensed to the patient already. Okay, so we talked about the bottom portion of the DEA Form 41 is used for when you're collecting controlled substances from patients that have already been dispensed. So this is a rule that DEA put into place in order to help patients get rid of unused controlled substances. For a long time, there was no mechanism for patients to get rid of unused controlled substances. Pharmacies could not take them back. Hospitals could not take them back. DEA started doing their drug take-back days, which they're still doing, which helps a lot. But at the same time they started doing that, they developed this new rule that allowed pharmacies to modify their DEA registration as to be an authorized collector. This is not a mandatory thing. You don't have to do this, but DEA encourages it. They encourage pharmacies to be authorized collectors, and they keep a list on their website so people can know where they can go to get rid of their excess controlled substances. And the idea here is we don't want people to have excess controlled substances, in their medicine cabinets that can lead to diversion and overdoses and so forth. But it does require you to modify your DEA registration so DEA knows, which locations serve as authorized collectors. I don't think I have this in the rule, in the book, but because I'm trying to focus on pharmacies. But the DEA rules on this allow manufacturers and distributors and reverse distributors and even long-term care facilities like nursing homes to serve as authorized collectors. Now, I don't think like most distributors are open to the public, so most distributors don't become authorized collectors, and I guess probably manufacturing facilities don't either. So you mainly see them at hospitals. The hospital has to have an on-site pharmacy to do it, and also in community pharmacies. And nursing homes can do this as well. So one of the things with these authorized collection bins is the rules are pretty strict on how these are set up, and I try to summarize some of those for you. But one of the main things is that the controlled substances can be put in there. They could be commingled with non-controlled substances. A lot of people will just clean out their medicine cabinet and throw other, and that's fine too. DEA doesn't really care. The goal is controlled substances, but people can also put non-controlled substances in there. But once the things are put in there, they're not to be touched. They're not to be counted. They're not to be sorted. They're not to be inventoried or individually handled. There's an inner liner in these things. Everything goes into the inner liner that's got to be sealed. But these drugs are not becoming part of your inventory, so there's no reason to try and see what's actually in there. There's all sorts of rules about where these can be. They've got to be within the immediate proximity of the pharmacy, so you can see them. They've got to be securely fastened, to the floor, to the building, so nobody could carry this thing and walk away with it. As I mentioned, there's an inner liner of these things, and these are tamper evident. And they have to be sealed immediately when they get full. And each inner liner has a serial number, and actually it's that serial number when you're going to destroy them using DEA Form 41, you'd have to, instead of writing the NDC numbers down, you write the serial number of each inner liner if you're going to destroy them on the premises. Again, most people don't destroy these things on the premises. They ship them away to be destroyed somewhere else. The other option that pharmacies that are serving as authorized collectors can have, instead of having these collection bins, is they can have a mail-back program where when you dispense controlled substances to patients, you also provide them with a package that they can mail back to the pharmacy any unused drugs whenever their prescription or course of therapy is completed, or if the patient passes away or whatever. And there's all kinds of rules related to how those mail back programs should work. And that's something that you can only accept mail back packages from your own patients. You can't accept them from other pharmacies. Okay, and on page 80, there's one more section I don't have a slide on this, but there is a provision in the Support Act, which was a comprehensive opioid bill passed by Congress back in 2018, but that allows disposal of controlled substances by employees of a hospice for a hospice patient. To make that legal, but DEA has not yet adopted any rules on this. I know it's been since 2018, but sometimes DEA is not in a hurry to pass rules even after Congress passed a law, but that is in the act, so I wanted to at least include that in the book in the middle of page 80. All right, so that's it for destruction. One thing I did want to say about all this discussion about destruction, destruction of these controlled substances, we're talking about controlled substances that are part of your inventory. In a hospital situation, you may have to waste controlled substances. For instance, if a nurse is going to administer a dose and it only comes in a 2 milliliter injectable and she's only going to give 1 milliliter, wasting of a control, you dispense that entire 2 milliliter syringe, let's say, the rest has to be wasted. So waste of a controlled substance is not the same as destruction of the controlled substance. We're talking about destruction of an entire bottle or some pills, but not wasting of the controlled substance. I recommend reading the DEA Pharmacist Manual that talks about waste of controlled substances, because you do want to do some record keeping for that as well, but that's different than actual destruction of controlled substances under these rules that we just discussed. All right, so that's it for this lesson. I will see you again in the next lesson.